So any injury to the skull, we know it lead to the injury to the brain. But the architecture of the cranial cavity is so beautifully made that it try to minimize the injury of the brain, which is very soft inside. First of all, the skull bones, they are selected, they are flat. So flat bones itself make the skull lighter. Plus, some of these skull bones, they are pneumatic bones. Pneumo means air is lost during their development. So it makes the skull more lighter. So in the general anatomy book, you have done types of the bone: regular, irregular bones, small, large, and one was pneumatic bones. So you will study pneumatic bones also in the cranial cavity. So we systematically study this whole of the cranial cavity, then you will understand every part of it. So this is the outer line of the cranial cavity. When we cut the vault of the skull is removed here. Vault means the upper norma verticalis, and the highest point of the skull is called. So vertex we have removed, and after that what we see? The diploe. Diploe means outer or inner table of compact bone, and what is sandwiched between is the spongy bone. So all the frontal, parietal, temporal, occipital bones, they are the example of the diploe. So this is the whole circumference of the bones constituting the cranial cavity. So you make this diagram in full page. Try to make it with me, then you can understand. Because anatomy is the subject of the diagram, you know. Without diagram, if you write any answer of any question in theory, nobody gives you the marks. Marks will be minimum without diagram. And if you make a good and colored and a well-labeled diagram, we don't read what you have written. If your diagram is correct, we give the full marks. So this is how to fetch the marks in the anatomy theory. So practice the diagram 100 times, then it will be thorough. Diagram is there, but you do not know from where we have to start. That is the main problem to the students. So I am giving you the lectures in the YouTube. See where I am starting the first line of the diagram. Then you can understand that how I am drawing, same is your point of starting of the any diagram. So that will give you the practice also. So this is the whole circumference. So this is the frontal bone, this is the parietal, and this is the occipital bone we have cut. Now frontal bone is pneumatic bone, and it lodges the air inside, trapped in here. So this is the air trapped. So where the air is trapped in the bone, it is called bones air cells. Bone air cells are there. Another pneumatic bone is behind your ear. When you touch here, what you touching? Which process? Mastoid process. So again it is filled with the air. It is also the example of the pneumatic bone. Frontal and mastoid process of temporal bone is the examples of pneumatic bones. So we divide the cranial cavity into three fossa or three depressions: anterior cranial fossa, middle and posterior cranial fossa. So first we will study the features of the what lies in the anterior, then we will study the middle, and this is the posterior cranial fossa. So this is the anterior cranial fossa, anteriorly. So features, number one, starting from forward to backward. So this is a sharp structure. This is called frontal crest. So frontal crest is the present on the inner surface of the frontal bone in the anterior cranial fossa, and the sharp margin of the bone will give the attachment to falx cerebri. Falx cerebri. So what you already know, what is falx cerebri? Is the double fold of the dura mater which separate the two cerebral hemisphere. So anteriorly it is attached here. Just behind it there is a blind foramen. The name of this foramen is Foramen Spinosum. So it is a blind foramen, but in some of the skull it is open. And if you put a wire here into the Foramen Spinosum, what you will see that it is coming into the nasal cavity. So the people who are having the Foramen Spinosum which is open, they are unlucky people. Why we say unlucky? Because if it is open, then it opens into the roof of the nasal cavity, and through this a emissary vein passes, and this emissary vein is the first tributary of the superior sagittal sinus. Because we know the superior sagittal, where the superior sagittal sinus lies, in the double fold of dura mater between endosteal layer and the meningeal layer, starting from here in the midline sagittal plane, posteriorly up to the internal occipital protuberance where it ends. So superior sagittal sinus is present in the upper border of the falx cerebri, which is the fold of the dura mater. The falx cerebri is the double fold of the dura mater, and in the endosteal and the dural layer here present a sinus which is called superior sagittal sinus. So if Foramen Spinosum is present and a vein will, emissary vein will from the nasal cavity will form the first tributary, or we can say superior sagittal sinus start from here, from Foramen Spinosum, which gives the first tributary to the superior sagittal sinus. So this is the nasal cavity. Then behind this Foramen Spinosum there is another bone which is not visible from outside, is called Ethmoid Bone. Ethmoid Bone is present, and in the midline there is a triangular raised area of the bone. It is a part of Ethmoid Bone. It is a raised triangular bony projection, and it is called crista galli. Crista galli. Crista means crest. The top point in the anatomy is called crista or the crest. Galli means hen. So when you see the hen, what is the crista galli? Is the red color hood of the hen is called, the cock is called. So it resembles the cock like head. So that's name is crista galli. On either side of the crista galli there lies a multiple foramen containing a horizontal plate of the ethmoid bone, having many holes in it, sieve-like. And in anatomy which is having multiple foramens, we use the word cribriform. Plate. Cribriform means having multiple holes. So it is again the part of the ethmoid bone. And laterally this ethmoid bone articulates with the again a horizontal plate of the bone, this whole bone. This bone belongs to the frontal bone, and this is called, and it is convex here and having a S shape elevation which resembles the alphabet H shape. This whole plate is called the orbital plate. Orbital plate of frontal bone. And it forms the roof of the bony orbit. We have done the orbit because below this eye the eyeball lies here, and we have done the dissection yesterday. So we have break this, then we go into the orbit directly after breaking the roof of the bony orbit. So roof of the bony orbit is the formation by the frontal bone, which is a horizontal plate, and this ethmoid bone also is a horizontal. Below this lies the nasal cavity, and what passes through these foramens is the first cranial nerve. What is the name of first cranial nerve? Olfactory nerve. So this, the crista oculi, and on either side there lies the horizontal plate having many holes. So the bipolar cells from the nasal mucosa is the olfactory mucosa. From the nose goes upward, and they pass through these foramens, multiple axons. This is how the olfactory nerve start formation, and all these small axons, they unite together, and what they form? A bulb-like structure, which is called olfactory bulb. So olfactory bulb lies on the cribriform plate. So in the Viva exam, we will ask you each and every. We will give you the skull, and we will put a long wire or a pointer, and we will ask the Viva that what is this plate, what passes through this, what is this foramen, what passes through. So cranial cavity is the important part of the practical. Every student will be asked any foramen or any feature of the cranial cavity. No student can escape from the cranial cavity. Skull will be asked to each and every student in the final exam. So thoroughly prepare the cranial cavity, and listen and make it in your diagram right now, and label it each and everything I am telling you. What passes through which part, name plus what is the importance. Then posteriorly, in the anterior cranial fossa, in the posterior part, there is a shelf-like projection. A concave shelf-like, sharp, bony shelf-like projection overhanging from anterior cranial fossa into the middle cranial fossa. And this dotted area belongs to another bone, is the sphenoid bone. So this dotted portion is called lesser wing of sphenoid. Lesser wing of sphenoid bone. So sphenoid bone lies in the middle of the, almost middle, anterior, a little bit anterior to the middle of the cranial cavity, and it resembles bat-like structure. As bat is having the middle is the body and wings are later on. So this is the lesser wing and this is the greater wing. So totally bat-like structure. This is called the, so it is fitted here. So that is called the sphenoid bone, looks like the bat-like outline. So this is the, its lateral part, this one. It belongs to frontal bone, and from here this is part of the greater wing of sphenoid bone. So together they form the crescentic concave margin of the and end of the posterior end of the anterior cranial fossa ends here. And what is present along this? Again intradural, intracranial venous sinus lodges here. And the name of this sinus is called sphenoparietal sinus. Sphenoparietal sinus is present in the lesser wing of the sphenoid bone. Then posteriorly, the lesser wing of the sphenoid bone has two bony projections which is projecting posteriorly, and they are called anterior clinoid process. Anterior clinoid processes. And anterior clinoid process, they give the attachment to the anterior part of the tentorium cerebelli. They give the attachment to the tentorium cerebelli, which is a tent-shaped horizontal sheet of the dura mater, below which the cerebellum lies and above it lies the cerebrum. So anteriorly it is attached to the anterior clinoid process. So again the crista galli, it gives the attachment to the falx cerebri. Both here and here is the attachment of the falx cerebri. Then this becomes posterior. So after doing the anterior cranial fossa, now we will switch on to the next, that is the features of middle cranial fossa. The features of the middle cranial fossa, they are so features in the middle cranial, so we have to focus in this area. So this shaded area is the middle cranial fossa. So anteriorly it is bounded by the frontal and the lesser wing of the sphenoid, laterally by the parietal bone, and posteriorly here this line represents the petrous part of temporal bone. So this constitutes this small area which is called the middle cranial fossa. It is very deep, and this concavity lodges the, that is the sphenoparietal sinus where it lies. It also lodges the lateral sulcus of the cerebrum. So lateral sulcus of the cerebrum start from here, and in this middle cranial fossa here is fitted the temporal pole, and here in the anterior cranial fossa the orbital surface and posterior surface of the frontal bone, here is the touches the frontal pole of the cerebrum, and on the orbital plate touches the inferior surface of the cerebrum. So cerebrum resembles your hand. So there are two cerebral hemispheres, right and left, separated by double fold of vertical sheet of falx cerebri. And two cerebral hemisphere has got superior surface. Superior surface is continuous with the lateral, so it is called superolateral. This is the inferior surface. Two surfaces, medial surface of cerebrum, they are joined by horizontally running corpus callosum. When we cut the corpus callosum, what we see? Medial surface of the cerebrum. So take your hand as a cerebral hemisphere from your left side, and from your skull is the right cerebral hemisphere. Exactly your hand. And it is hollow from inside. The cavity is called lateral ventricle, filled with the CSF. Put the anatomical position, CSF will leak. Put a sellotape here. Now put the horizontal, CSF will release. What is the sellotape? Septum pellucidum. This is septum pellucidum. So when this brain develops, it is lateral ventricle was so large because there is no any development of the basal ganglia still. No corporal chiasm has developed yet. No corona radiata, no crus cerebri, nothing is there. Only grey matter, white matter and lateral ventricle. Later on they will develop. So if this is the cerebral hemisphere, so this is the frontal pole, frontal lobe. Sulci gyri are present on this surface, you make a diagram. So this cerebral hemisphere, now it is fitted here like this. So frontal pole will touch this surface and inferior surface of the frontal lobe will touch the orbital plate of the here. And how you make the frontal inferior surface of the cerebrum? Make a big kidney, make a suprarenal gland. What you have made? Inferior surface of the cerebral hemisphere. So simple to me. This surface is the frontal pole, this is the temporal pole, this is the occipital pole, the end. This is the medial surface, this is lateral surface. So this surface is the inferior surface of frontal lobe. Where it lies? The soft brain on the orbital plate. So this S-shaped alphabet will be having an impression on the inferior surface. We make here also. What is the name of this S-shaped sulcus? Is called orbital sulcus. Who has made it? The convex part of the orbital plate, because it is having the S-shaped impression, so same impression comes on this soft brain. So this is how to impose your brain on the skull cavity, then you can understand why it is so. And medially what is present here? A sulcus which is called olfactory sulcus. And where the olfactory sulcus lies? On cribriform plate. And what you lie here? The first cranial nerve. Because from the foramen what is coming? Olfactory nerves, and they form the olfactory bulb lies here. Divided into medial and lateral stage. So olfactory sulcus lodges the olfactory bulb. So you have superimposed the cerebrum on here. That is how to study it. So this is the middle cranial fossa. The features of the middle cranial fossa, they are in the center there are present. This is the body of the sphenoid bone, bat-like. My two thumbs, they are the body. And this is small lesser wing, this is the greater wing. So from this body, lesser wing, and from here, the greater wing. See, only dotted part is a bat-like, resembles bat-like structure. The dotted area belongs to the bone which is fitted between the frontal, parietal and temporal, bat-like structure, that is called sphenoid bone. Three parts. Center part is called body, lesser wing and greater wing. Lesser wing is property of the anterior cranial fossa. Greater wing, bigger one, is the property of middle cranial fossa. So, and this is the body. Center part is the body. So overhanging the anterior clinoid process, there is two canals. They are called optic canals. And we know what passes through optic canal. And just lateral to this this anterior clinoid process, here lies a foramen, which is zigzag-like, irregular, on the lateral surface of the body of the sphenoid. It is called foramen lacerum. Lacerum means lacerated. Lacerated means irregular margins. We have done in the scalp lacerated wound and sharp edge wound in the scalp. So lacerated means irregular margin. And what passes through the foramen lacerum? That you have to remember. Internal carotid artery. The same artery which will form the circle of Willis. So circle of Willis is also formed here. So through this, internal carotid artery comes, and here it ends to continue as middle cerebral artery. And the same artery will give the, below the anterior clinoid process, a branch which goes into the orbit and lies inferolateral to the optic nerve, which is coming out from the optic canal on both the sides, right eye and left eye. So this artery is inferolateral, see, inferiorly and lateral. And in between the two anterior part of this body of the sphenoid, it produces a irregular margin here. This one, this is called Sulcus Chiasmaticus. Sulcus Chiasmaticus, because two optic nerves, they unite here to form the optic chiasma. But optic chiasmaticus, sulcus chiasmaticus, doesn't lodge the optic chiasma. Optic chiasma lies a little below. Then this body of the sphenoid anteriorly, just below the sulcus chiasmaticus, has a area which is called tuberculum sella. This tuberculum sella is a horizontal bone which on either side has got small raised area of the bone, which is called middle clinoid process. Sometimes it is absent. If it is present, it also gives the attachment to the anterior free end of the tentorium cerebelli. Sometimes the anterior and the middle clinoid process, they are joined by a ligament. This ligament is called carotico sphenoidal ligament. And sometimes it is ossified to form a bone. So then a bone is attaching the middle and the anterior clinoid process, below which lies the ophthalmic artery passes safely. It forms a bony canal sometimes. Then posterior to the tuberculum celli is a fossa, and behind the tuberculum celli there is a fossa which is called hypophyseal fossa, or what is the pituitary fossa. Now pituitary is the master's gland, so it lies over here. So this whole superior surface of the body of the sphenoid is called the sella turcica. Sella turcica. It resembles the Turkish saddle which we put on the horse for the horse riding. So its shape is saddle-like. It is a depression and concavity is there. That's why it is called sella turcica. So sella turcica has got the anterior part is called tuberculum sella, and pituitary fossa where lies the pituitary gland. Sometime at the floor of the pituitary fossa there lies a canal, and this canal is called carotico pharyngeal canal, and it is considered that this is the remnant of the Rathke's pouch embryologically, which gives the development of the anterior or the adenohypophysis. Rathke's pouch remnant. Then the posterior part, this part of the sella turcica of the body of the sphenoid, it is called the dorsal celli. Dorsal sella. And the dorsal sella, it bears the two processes which is called the posterior clinoid process. It gives the posterior clinoid process, which gives the attachment to the tentorium cerebelli. Then this lateral surface of the body of the sphenoid. Here lies the cavernous sinus. On either side here lies the right and left cavernous sinus lies over here. And the lateral wall of this body of the sphenoid bone forms the medial wall of the cavernous sinus. And there is a F shape, alphabetically F shape groove is there. And this F shape groove lodges the internal carotid artery here on the lateral surface and inferior. So internal carotid artery lies infero-lateral to the cavernous sinus. The pulsations of the internal carotid artery moves the venous blood in the cavernous sinus and prevent it from the clotting. So that's why it is very near to the cavernous sinus. See the architecture while you are studying anatomy. Every minute thing has been kept in mind. Who is the maker? We don't know. So this is the middle cranial fossa. Then below this overhanging sharp edge, here lies a fissure which we have done, that is called the superior orbital fissure. Same fissure through which the many structures we have to pass. So it lies here. Just behind and lateral to it, there is a round foramen. Because of the roundness, it is called foramen rotundum. Rotundum means round shape. And what passes through this is the maxillary artery, maxillary nerve. Passes through this. Just lateral to, posterior and lateral to this round foramen, there is a oval foramen. And this oval foramen is called foramen ovale. Always remember, the most important and easy foramen to remember. What passes through the foramen ovale? Remember the formula, male, M-A-L-E. But abbreviation is not enough. M stands for mandibular nerve. A stands for accessory meningeal artery. L for lesser petrosal nerve. E for emissary vein, which joins the pterygoid venous plexus with the cavernous sinus. Just inferior, posterior lateral to the foramen spinosum is lying over here. Small minute foramen is the foramen spinosum. Why it is called spinosum? Because only the tip of the spine can enter. It is so small. But four things passes through this small foramen. You have to remember, number one, emissary foramen, emissary vein, same which connects the cavernous sinus to the pterygoid venous. Number two, middle meningeal nerve, that is called nervus spinosus, other name. Then third is middle meningeal artery passes through, never vein. The lateral surface of the middle cranial fossa from the foramen spinosum lodges the grooves. One groove goes anteriorly, one groove goes posteriorly. This groove is for middle meningeal vessels. And middle meningeal artery comes from here and it goes to supply the dura mater. It lies between dura mater and skull bone, inner table. Vein and artery, both are present here. Then posterior to this part of this bone which is raised like the pyramid shape is called the petrous part of temporal bone. Petrous means, what is the meaning of petrous? Stony hard, like a rock. Stony hard is the hardest part of the skull bone. So it is having the outer slope and the inner slope. So it is like this. The upper border, this is called the superior border of the petrous part of temporal bone. And again it lodges a sinus which is called superior petrosal sinus, which goes into the cavernous sinus here and gives the blood. Superior petrosal sinus. To the outer slope, here in the near, this is called the apex of the petrous part of temporal bone. Here like a triangular smooth impression or a smooth area near the apex of the petrous part. This is called trigeminal impression. This is called the trigeminal impression. And trigeminal impression is having the double fold of the dura mater, which forms a cave-like structure which is called Meckel's cave. Meckel's cave. And fifth cranial nerve, the trigeminal ganglia lies here. Trigeminal ganglia lies in this cave that is called the Meckel's cave, made by the double fold of the dura mater. On the outer slope, near the apex of the pittus part, you have to remember, a smooth area lodges here. Then, question arises, why it is so hard, stony hard? Why, if you break, below this lies the middle ear and delicate internal ear. 3 semicircular canals with bony labyrinth and membranous labyrinth lies below this. So every protection has been given, that's why it is stony hard. And the vertical semicircular canals, sometimes there is a elevated arc-like bony projection is there. This arc-like structure is called arcuate eminence. Arcuate eminence. If it is present, it means it is because of the vertical semicircular canal. There are 3. 2 are horizontal, 1 is vertical. So this is vertical. It made a elevation of the bone. So below this lies the internal ear somewhere here, with bony labyrinth, with saccule and everything. And later to this, if you break this, what you find? A matchbox-like structure. What is that matchbox like? Middle ear. Middle ear is exactly like the matchbox. Roof, floor, anterior wall, posterior wall, lateral and medial. So matchbox is like the middle ear cavity. Tympanum, that is called tympanum. Then this lateral part is the squamous part of temporal bone. And internal ear, middle ear and lateral one here lies the external ear with external auditory canal on which the pinna is attached. Medial to this is the bony part of the auditory canal. Outer is the cartilaginous part. Remember your +1, +2 ear chapter. So tympanic membrane lies over here on the lateral wall of the middle ear. So these are all delicate structures. Middle ear, tympanic membrane, semicircular canals, saccule, cochlea. So bony protection has been given. That's why it is the pitras means stony hard. Then this lateral part of this middle cranial fossa, it belongs to the squamous part of temporal bone and tympanic part and pitras part. This area is called Tagman Tympani. Tagman Tympani. So Tagman Tympani is a horizontal plate of the bone contributed by the squamous part of the temporal bone and the tympanic part as well as the pitras part. And this horizontal plate of the bone forms the roof of middle ear, roof of the external ear also. And anteriorly, it also forms the roof of Eustachian tube, which is starting from anterior wall of middle ear and opens into nasopharynx, behind the nasal cavity, somewhere here. This nasal cavity ends here, it opens here, into the pharynx. So this is the Tagman Tympani. So this much you should know about the features of the middle cranial fossa and what structure lies where. Then comes the last is the posterior cranial fossa. It's the largest, but it is the most simple. Nothing is much is present here. So anteriorly, the posterior cranial fossa is having this slope-like oblique part of the bone. This one. Anterior to the foramen magnum. This one. This is called the basi occiput. The features of posterior cranial fossa. In the posterior cranial fossa, the features they are number by one. They are number 1, basi occiput. Basi occiput is also called clivius. Clivius is like a baby slide. It is not vertical, it is baby slide like oblique. And what touches it? Midbrain, pons and medulla, anterior surface of brainstem rest over it. Clivius. Brainstem, midbrain, pons and medulla. So that's why it is sloped. So we always make the brainstem never straight. We always make oblique. Why? Because it is resting on the oblique. So this clivius or occipit is upper half is formed by the body of the sphenoid and lower is formed by the occipital bone. Because this whole bone is the occipital. So occipital, this is the sphenoid bone. Later to the clivius, where the pitous part of the temporal bone, the inner slope or the medial slope ends, and the base of occipital, there is a small fissure, and this fissure lodges the inferior petrosal sinus. This is superior petrosal, this is inferior. Where the inferior petrosal sinus ends, that is lateral to the foramen magnum. There is again a foramen. In the posterior cranial fossa, this is called jugular foramen. Jugular foramen. Remember, jugular foramen has got three parts: anterior, middle and posterior. Anterior, middle and posterior. Different structure pass through them, that you have to remember. In the anterior part passes the inferior petrosal sinus. In the middle part, 9th, 10th and 11th nerve, they go extracranially, like facial nerve stylomastoid. So from here they go out. 9th, 10th and 11th cranial nerves. The posterior part is the start of internal jugular vein. Internal jugular vein start from here. So here lies the superior bulb of internal jugular vein. Because we know the cavernous sinus lies over here. On either side there are two, right and left. They are joined together by posterior intercavernous and anterior joined by anterior intercavernous. This is the position of cavernous sinus. We will ask you, put your finger where the cavernous sinus lies. On either side of pituitary fossa. Pituitary gland forms the medial wall of cavernous sinus. And this is the lateral wall. So this is the superior bulb of the internal jugular vein. The inferior petrosal sinus lies over here, and ultimately whole of the blood collected from this is fronto-parieto-sphenoidal sinus also comes. Two veins from the eye, superior and inferior ophthalmic vein, they also opens into the anterior tributary of the cavernous sinus. Middle meningeal veins, they also open into cavernous sinus, lateral tributaries. Then four hemisphere veins, which connects the dangerous area of the face, pterygoid venous plexus, with the cavernous sinus. Four hemisphere veins you have to remember. One passes through foramen ovale, it also opens into cavernous sinus. One passes through foramen spinosum, it also passes through this. One passes through foramen lacerum, and fourth passes through a accessory sphenoidal foramen from sphenoid bone. The four veins, they bring the venous blood. See, the pooling of the venous blood is occurring in the sella turcica with the cavernous sinus lies. In the middle cranial fossa, it is higher. When whole of the blood is collected from anterior and the lateral tributaries and posterior tributaries, now it is like the waterfall. Whole of the blood automatically in posterior cranial fossa is lower in position. Middle is higher. So this is the cascade of waterfall. Whole of the blood will come through the inferior petrosal sinus, and it will, whole of the blood from the cavernous sinus will open into internal jugular vein. It goes out. So see what is the architecture, how the blood is coming from higher position to lower, automatically with the gravity. Nothing to be done. Because all the cranial fossa, they are three steps. Anterior is higher, middle and lower is the posterior. They are stepwise. They are not at the same level. Then The inner slope of the pituitary bone. On the straightway, if you make a line at the external occipital, external acoustic meatus, at the same line, in the inner slope of pituitary bone, there lies a hole that is called, this is called internal acoustic meatus. Internal acoustic meatus. Same line, external ear, straightway on the three. And what passes through this? We have to remember number 1, 7th nerve. Number 2, 8th nerve. Number 3, labyrinthine vessels. Labyrinthine vessels. Labyrinthine vessels, they supply the membranous labyrinth, semicircular canals, saccule, cochlea, everything. Labyrinthine artery is the branch of basilar artery, you remember from Pons. So they enter into it. Otherwise, this is stony hard. But who has made it a weak internal acoustic meatus is a weak point of the pituitary. Whenever there is a fracture of this posterior cranial fossa, the fracture line passes through internal acoustic meatus. It will break it. So during road making in the hills, if there is a rock is there in front of the road, what they put? Dynamite. Where they put the dynamite? Exactly at the middle of the rock. It will burst. Same is here. Internal acoustic meatus lies middle of the pitus part. That is the cause of break of stony hard pitus part. So this is the jugular foramen. Then behind the foramen magnum, and on either side there lies a hypoglossal canal. Hypoglossal canal. And through this hypoglossal canal, what passes? The last cranial nerve becomes extracranial. Then on the posterior margin of the foramen magnum, there lies a triangular area, smooth area. This triangular smooth area is called Vermion Fossa. Vermion Fossa. Why it is called Vermion Fossa? Because inferior vermis of the cerebellum touches here. Cerebellum has got 2 cerebral hemisphere, and what is the middle? What joins? Not corpus callosum. 2 cerebellar hemispheres joined by gray matter, that is called vermis. So that touches here. And from posterior there is a crest. And posterior to this there is a internal occipital protuberance, like the external, exactly inside the external, the internal occipital. And from this internal occipital protuberance and foramen magnum, there is a internal occipital crest. Outside there was external occipital crest. This is the internal occipital crest. Then from either side of the internal occipital protuberance, there is a transverse groove which touches the pitus part of temporal bone, the posterior part. So there is a groove, large groove is there. This groove is for the internal, and this is the groove. It touches the pitus part here in the posterior cranial fossa. So this groove is for the transverse venous sinus. Transverse. So from here the superior sagittal sinus start, and where it ends? Internal occipital protuberance. And from here, from cerebellum, a small sinus comes, which is called occipital sinus, which opens here, and whole of the blood of the superior sagittal sinus comes here. Then this sinus goes into transverse sinus, and this is the posterior part of jugular foramen. So from here, a alphabet S-shaped sulcus is present. S-shape. This is called sigmoid groove for this sigmoid sinus. So whole of the blood coming from the cerebrum to superior sagittal sinus go to the transverse sinus, and transverse sinus to the sigmoid sinus, and sigmoid sinus will give the start of internal jugular vein, which goes out of the skull through the jugular foramen. So this is whole of the venous blood from the brain goes out of the skull to this emissary foramen, that is the jugular foramen. Same is happening on the right and left side. So all the sinuses, superior sagittal sinus, inferior sagittal sinus lies over here, lower border of the falx cerebri. Then here lies the occipital straight sinus, and here lie the great cerebral veins, which opens here into the straight sinus. Then it goes this transverse sinus, which goes into S shape, sigmoid sinus, and ultimately goes out internal jugular vein. So this is how the internal jugular vein comes and how the venous blood goes out. Now the two lips of the transverse sinus give the attachment to the tentorium cerebelli, which is a horizontal sheet. So it is lodges over here, over there, but anteriorly, laterally it is attached to the apex of the pituitary-temporal bone on either side. It is a tent shape, and anteriorly attached to the anterior cranial process, posterior clinoid process, and middle cranial process, and anteriorly it is deficient. So this is the tent shape structure. Oh, anteriorly it is a U-shape opening is there. Why this opening is there? Why? Because through this what has to pass? Brainstem has to go down into the foramen magnum, and below this tent shape what lies? Cerebellum. So below this transverse sinus groove, this whole area is called the cerebellar fossa. Cerebellar fossa, because cerebellum lies over here. And above this sinus, this one, here lies this is called cerebral fossa, because cerebrum, the occipital pole touches here. So above the tentorium cerebelli, which is attached here, a tent-shaped structure, below this is cerebellar fossa, and above this groove, this fossa is called the cerebral fossa, and here touches the occipital pole posteriorly. So there is a groove is there for the occipital pole. So this is how you have to do the whole of the cranial fossa in 3 parts, and what lodges where, that you know. You have to superimpose the brain inside the cranial cavity. That's all. Thank you.